Hello everyone, welcome to this program focused on African women's health, a program that is committed to promoting the health of African women at home and abroad. We share the global message of health for all and emphasize that African women must not be left behind in optimal health. Just in case you are joining this program for the first time, my name is Dr. Olayide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. I thank you for joining in and I appreciate your time for doing so. Last week, if you have not forgotten, we looked at the findings of a research topic that explored the issue of domestic violence or intimate partner violence, and presented the first theme of a published paper and promised that today we will be looking at the second theme. The theme we looked at last week was suffering in silence. And the one we'll be looking at this week is reluctance to seek help. In case you were not around last week, I encourage you to look at last week's video, and I also provided a link to the published paper, even at the heading of this particular video. Okay, so let's go straight now to the second theme, reluctance to seek help. Despite vivid accounts of intimate partner violence experienced by the West African migrant women who took part in the study, almost all the 21 women expressed their reluctance to seek help. When asked about the reason behind this, they spoke about 4 reasons behind their reluctance to seek help. Number 1 was their perceived severity of the consequences of reporting the abusive husbands. The women expressed the fear of being left alone as sole parent for their children in the event that the law enforcement agencies arrest their husbands. Number 2, they identified their low level of integration into the Western culture. And the women's discussion on this point revealed a diversity in their viewpoints. The women stated that having been in Australia for more than 5 years and supposedly perceived as more integrated to the Australian culture, those women that fall into this category emphasize that intimate partner violence must be openly reported and discouraged. Meanwhile, those that have been in Australia for 1 year or 2 years or even less than that had a different perspective in terms of their willingness to report the experience of domestic violence. Number 3, the women's understanding of what constitutes intimate partner violence was another reason that was given. About half of the participants did not consider verbal and financial abuse as violent, and that only physical hitting is better considered as intimate partner violence. Number 4 reason was that perception about agencies put in place in Western countries such as Australia to support women living with intimate partner violence are considered as not relevant to them. And relevant transcripts in this direction include all these agencies will not bring you together. Rather, it will even make it worse. Why do you need to go and report to them or seek their help when you know it's not going to help? Because intimate partner violence is acceptable. No one sees anything wrong with it. We may now be asking, what then are the implications of these findings on the health of West African migrant women in Australia? There are 2 important implications. Number one, there is the need for more awareness on what constitutes intimate partner violence, the different types, and what the supportive agencies in Australia and other Western countries have to offer women living with intimate partner violence. Number two implication is that it is important that nurses understand the cultural barriers that can impede immigrant women's ability to seek out and receive appropriate support and intervention, and then provide opportunities for these women to disclose and discuss their experiences of intimate partner violence. And that is it for me for this week, especially on this particular topic. Next week, we'll be starting a series on another important women's health topical issue, female genital circumcision. Female genital circumcision, also known as female genital mutilation. I want to thank you so much for your time with me this week. I eagerly look forward to next week when we shall meet again next Monday on this program focused on African women's health. Please like this video and share it, and together let's work in ensuring optimal health for African women. Until next week when we meet again, that's it for me. Thank you.